G'day, I'm Ted Jedynak, podiatrist and international educator, helping health practitioners get even better results, clinically and commercially. I'm really excited about this opportunity I have for you today because you are going to hear a truly inspirational adventure of a podiatrist she's totally crushing it. I know this is going to help you in your clinics immediately. I met this dynamic lady, Lucy GILLIVOUR, just last year at our foot mobilisation and manipulation workshop here in Adelaide. And as I observed Lucy and her manual therapy skills, I thought, wow, what a natural. This girl's got it all going. Lucy and I have been in touch with each other from time to time since then, and what Lucy has done since attending our workshop and serving her local community in Victoria has been truly sensational. And that's why I asked Lucy if she would share her great adventures with the FMT family so that you too could benefit from Lucy's experiences. So I'm really grateful to have Lucy on the other end of the line. So thank you, Lucy, for taking my call.
No problem, Ted.
Look, rather than me telling you about Lucy, I'm going to let her tell you all about her all herself, because she probably knows more about herself than I do. So, Lucy, would you please tell us your fabulous story about how you ended up being a podiatrist and with particular interest in manual therapies? How did that all come about?
Well, I did ballet since I was 3 years old. So I did ballet for 18 years, and at the end of my high school degree, I went, what do I want to do with my life? I wanted to work in sports, but at the end of high school, you don't know what you want to do. So I got into university doing a science degree, finished that, and then I was seeing a podiatrist because unfortunately due to I fractured my foot thanks to ballet being on point, and saw a podiatrist and I was really inspired by what they did for me. So I decided to enroll in a Bachelor of Health Science and Masters of Podiatry Practice. And ever since then, I've been a podiatrist.
All right. Now, Lucy, you've done some other type of body work as well, though, haven't you?
Yeah, so during my university degree, I was working as a sports trainer at my local football clubs and soccer teams.
Okay. And do you have any experience in remedial therapy or any hands-on treatment services?
So I was working under a remedial massage therapist and a myotherapist at the time, and they were teaching me how to massage my football patients and get the best results with them. Okay,
great. So you have, I guess, more hands-on experience or exposure to hands-on services than the typical podiatrist. Would that be fair?
Yeah, I had, before I graduated, I had 7 years of experience massaging.
Okay. All right. So, we've got the ballet background. Now, I'm just thinking, with this type of history, I'm probably a little reluctant to mention my dancing career. Did you know that I tried tap dancing?
I did not know that.
Oh, well, yes. The problem was I kept falling into the sink, so didn't last very long. Oh, you're very polite.
That was bad.
Shocking, sorry. It might be a sign of things to come. Maybe I'll edit that bit out. Okay. Okay, so in this interview, we're going to discover the key steps that can help a practitioner with minimal manual therapies experience progress to being a key practitioner in their local community. So tell me, how did you become so involved in manual therapies for foot and leg conditions? Was this specifically with your sporting teams?
It wasn't specifically with my sporting teams. It was more as I was studying podiatry, I was a bit disillusioned by the whole practice. And I said, this person's coming with this injury, we prescribe them orthotics. I'm like, no, well, back at my footy club, I do massage for their legs. Why didn't I incorporate that into their therapy?
Yes.
And I thought, there's more to podiatry than just orthotics, and there's also manual therapy involved in it.
Ah, okay. So how did you first hear about FMT or foot mobilisation therapies?
It was in my 4th year of university, and one of my friends had placement in Adelaide with this crazy guy who saw 40 patients in a day, and he just mobilised their feet and didn't do any general care. And I was like, what? That's crazy. He must be crazy to just do that.
Okay. Who was that?
It was V. Nguyen.
Okay, fantastic. All right, so someone who was very brave venturing out. Okay, so what was your initial impression of this mad foot mobilisation man then?
I actually asked her, I'm like, is he a chiropractor or an osteopath? And she's like, no, he's a podiatrist. So I thought you must have had training in other therapies.
Yes, would you say, Lucy, that you found something lacking in your skill set that prompted you to explore FMT and manual therapies?
Well, working at the footy club, I was exposed to massaging, and I worked with some chiro and osteo students, and they would then mobilise someone's spine or hip
Yes.
or leg. And I was like, well, we can mobilise the foot, can't we?
Uh-huh.
And that inspired me to get involved in joint mobilisation of the foot.
Okay, so did the chiros or the osteos, did they do any foot or ankle work that you noticed?
Not that I noticed, no.
Yeah, it's interesting. My observation is the foot and ankle tends to kind of get left out. They all take care of the rest of the body. I like your thinking in that, well, if we can mobilise other joints of the body, why not mobilise the foot? Because it's got quite a few joints. All right. So, can you please describe your journey from when you graduated as a podiatrist, and what was the pathway to where you are now?
Well, when I graduated, I was talking to some friends, and I decided I'm going to use all my money that I earned my first year to learn as much as I possibly can about podiatry and do all the courses I possibly can, so I know from my first year how to be a great podiatrist and be great at what I do.
Wow.
And since then, pretty much I enrolled in the foot mobilisation course as soon as I graduated. I think it was December or January I enrolled.
Yes.
And I was so excited to go along in May because it was one of the first courses I did go to.
Uh-huh.
And that was a big turning point in my career because I first started as a podiatrist in January, and I was kind of treating how we were taught at university, and I kind of forgot that I could massage and I could do manual therapies.
Okay.
And then I went along to the foot mobilisation course, and then I came back and I was like, oh my God, I can mobilise joints, I can massage, I can treat patients manually without going through traditional podiatry measures.
All right. So once you finished the course, what happened when you got back into the clinic? Like, what did you do? How did you, I suppose, take those new skills that maybe weren't so experienced with? How did you apply those when you were back into your clinic?
Well, one of the questions that you asked me on the course was, can you think of a patient that you could help with foot mobilisation therapies? And straight away I remembered there was a patient I could help with it. And when I got back to the clinic, I called him up on the Monday morning and said, hey, I've got this new treatment option.
Mm-hmm.
Would you like to come in for a complimentary consult to see if it will help your foot out?
Okay, great. Can you tell us a little bit about that patient? Why that patient? What did they present with? What was their concern?
He was one of my first patients, and he presented with really stiff feet. And he had a pes cavus foot type, and at uni you're not really taught a lot about the pes cavus foot type. You're told put an orthotic in there and see you later.
Uh-huh.
And going through that, his foot was very stiff when I remembered first assessing it.
Yes.
And he was in a lot of pain, a lot of osteoarthritic pain. He was only 34 years old and worked at Dan Murphy's on his feet in work boots.
Okay.
So I got him to come in, and we ended up mobilising all his joints and loosening off his cuneiforms and cuboid.
Uh-huh.
And his feet felt a lot freer after the consult, and it was the most pain relief he's had in about 4 years.
Oh, great. So when you say felt freer to you or felt freer to him? Or
Freer to him.
Ah, okay, great. What about your experience? Like, how did you feel with your hands? Like, were you able to detect or feel different quality differences in joints as, from one treatment to the next with him?
With him, because I saw him twice a week for the first 3 weeks as recommended,
Uh-huh.
we could definitely feel by week 3 it didn't take as much effort for me to mobilise joints. The first time I saw it was so stiff, and my hands were quite sore after doing it.
Yes.
And then by the 3rd week, things would just cavitate and crack into place quite easily.
Okay, nice. So, Lucy, was there something that, or let me ask, how many people, or what percentage of your working day or working week now involves manual therapies or mobilisation techniques?
Every patient of mine gets manual therapy or mobilisation, whether it's in the form of actually going through the FMT protocol, or whether it's in the form of a foot massage, or I use instrument-assisted massage as well on the foot. Every patient gets it.
Okay.
It benefits everyone.
Great. So does that mean you don't do any general treatment work? Or do you...
I do probably about 60% general treatment, but all my general treatments also get foot mobilisation or massage.
Really? So why would you mobilise someone who's having general treatment?
Because just because they're coming for general treatment doesn't mean they don't have other foot concerns. And one of the patients that I remember, she came in, I've been seeing her since I started working there, And we were going through now. He was like, oh, I've got this new treatment, just asking her a few questions. She's like, yeah, I do have really poor balance in one of my feet. I've rolled my right ankle a whole lot and it just keeps rolling and it's really unsteady. So we started going through the FMT protocol. We found some things we'd like to treat, and we did end up treating her, and we've now improved her balance after 3 months of treatment.
Oh, wow, sensational. Can I ask what age group would that client be in?
She was 65 when I started treating her.
Okay, and we know that balance, I'm thinking 65 is not elderly, but some people might call it an elderly age group, but so important that balance and stability is as good as it can be with those people of that age group. All right, terrific. Lucy, do you have a favourite FMT patient story or a case study that you'd like to share?
Well, her name's Norma, and that's the 65-year-old patient with poor balance who I was seeing for general nail care.
Yes.
And just as podiatrists, we do get to ask our patients lots of questions and find out about their life. And it was from just talking to her that we found out she did have poor balance, and she used to play lawn bowls, and she wasn't playing it anymore because she felt really unsteady on her feet.
And so how did you approach Norma with the new treatment option? What did you say? What was her response?
Well, she didn't think that I could do anything. She's like, oh, I've got poor balance, but, no one can do anything for it. I've just got to work on it myself. I'm like, hang on, no, I can do something for that. We're the foot and ankle clinic.
Yes.
Balance is involving the foot and ankle, so let's work on that together.
Nice. And so how did the treatment go? Was she also someone, how often did you see Norma?
We started off with 2 times weekly for 3 weeks as prescribed, and then 1 times weekly for 3 weeks. And then we moved to a monthly procedure, and now I do it each time I see her for nail care every 8 weeks.
Every 8 weeks. Okay, great. Has Norma commented about any changes, either positive or negative, with her balance? Has that improved and maintained that way, or has that changed over time?
Norma noticed after the first treatment she felt more steady on her feet.
Okay. Great. And then what happened from there? Did things continue to improve?
And then once we moved to the weekly protocol, after 6 weeks of initiating treatment,
yes,
she was able to go back to lawn bowls and feel confident stepping onto her right foot where she had previous ankle sprains, but it wasn't wobbling anymore.
Okay, nice. What about exercises? Is Norma, did you recommend any exercises to go with your mobilisation treatment?
We did. We found her perineals were quite weak on the lateral aspect of her foot, so we gave her some banded exercises to improve the strength of her lateral compartment.
Okay.
We also did some interossei activation by getting her to spread her toes, which is something a lot of patients can't actually do.
Yes. Okay.
And it helps with balance.
All right. And how did you find her compliance with the exercises? Was that a challenge for you?
Well, I was seeing her twice a week, so she was at least doing them twice a week with me in the clinic. But she was very motivated to get better, so I think she was doing them quite often because she improved very rapidly.
Okay, excellent. Now, with Norma, is she a private client that you see? Like, does she have to pay for her treatment services each visit?
Yeah, she is a private patient.
Okay, so how did you go then, the whole transition from, okay, you're seeing Norma every 8 weeks for her routine nail care, and now you're recommending that she comes in twice weekly and she's going to have to pay for that. How was that experience?
Well, since she was one of my first patients the week after I got back, I was like, oh, would you like a complimentary 2 times weekly for 3 week session?
Okay.
Which after that, once she realised the benefits of foot mobilisation, she was happy to pay after those first 3 weeks.
Okay, great. So you basically offered her I suppose a motivation, or in marketing terms, there was a pretty good incentive to take up your offer by the sounds of things.
Yes.
Yeah, okay, nice, great. And so you still see her now? She's a long-term client by the sounds of it?
She is. I see her every 8 weeks for nail care and ongoing foot mobilisation.
Okay, nice work. So how long does it take for you to do a foot mobilisation part of the treatment?
2 to 3 minutes.
What? You can't do a treatment in 2 to 3 minutes? What do you mean?
perfected my skills. It's quite easy. Once the patient knows what to expect, they're in the right position.
Yes.
We don't really talk while I mobilise the feet, so it's quite a quick procedure.
Okay, nice work. Good. And so have you found that with someone who's coming in just for mobilisation and a relatively short period of time, that they're still willing to pay for that service?
Well, the mobilisation only takes a few minutes, but I do complement it with some instrument-assisted massage as well of the foot and sometimes calf, depending on their problems. So it ends up being a 10 to 15-minute consult.
Okay, terrific. And that's, sounded like a nice comprehensive service with mobilisation of the joints and then also some tool-assisted release of the surrounding tissues and muscles and tendons. So nice work. Cool. Lucy, what do you think of podiatrists and your colleagues who might be questioning the evidence behind joint mobilisation in the podiatry profession?
I tell them to question everything, do your own research, question everything, try everything there possibly is, and find out what works for you. Not everything is represented well in evidence, especially when it comes to foot injuries. We know that there's a lot of evidence behind knee injuries, but when it comes to ankle injuries, there's not a lot of high quality evidence for it, but we know treatments work clinically.
Okay. Have you had any skeptics or any run-ins with colleagues questioning what you're doing?
My boss was definitely a skeptic when I first started. He's a very old school podiatrist who's all about orthotics.
Yes.
And once you prescribe orthotics, that should fix their problem. He became not a skeptic after I was treating him for his talus pain. He had pain in his ankle, and I was like, let me just do some foot mobilisation when you're in the clinic and we'll work through it. You've got orthotics, you're doing injection therapies. Let's try this as well. Let's try something different. And after we did treatment on him, he was a believer.
There's nothing like and I found this both with professionals and also clients and patients, where the more skeptical they are, the greater the degree of conversion into being raving fans. So, and nice that that's someone who happens to be your employer. So, well done, great stuff there. Lucy, what's one key piece of advice you would offer to podiatrists who treat musculoskeletal conditions of the foot and leg?
Learn how to massage, learn how to manually manipulate people's muscles and joints. Just get as many patients as you can, massage their calves, massage their feet, be able to palpate their muscles. When I was massaging, the advice I got from my employer then, who was a myotherapist, was get your hands on as many legs as possible. No one's going to say no to a massage.
Yes.
Offer massages to everybody and get used to doing it.
Oh, great. So what advice would you give to, I was going to say a young you, but you're still incredibly young. So what would you give, say, an undergraduate you when you were trying to develop your palpation skills?
Go and work at a local football or soccer team. They always need help. They always need someone to help massaging. You'll learn the most you'll ever learn at a football club. I learned more at my footy teams, my soccer teams, than I did at uni about manual therapy and injury management and injury prevention. Oh,
fabulous. This is quite spectacular here, Lucy. I'm most impressed with your, I suppose, your commitment to your own professional development. If I suppose, I was going to summarise what some of the key points of the Lucy GILLIVOUR story would be, is the number one thing about being committed to your professional development, in making that commitment of everything you earn in your first year upon graduating that you're going to use for your professional development. I'm going to take my hat off to you for that, because I think that's most impressive. Also, that the second key point I would take away would be the pes cavus stiff foot type, and the limited, I don't care whether you're a student or a seasoned practitioner, everyone I speak to often say the same thing, is like, what do you do for those feet? Because we just don't get taught, or we don't get the opportunity to know about other treatment options. So I'd say congratulations on that as well. And the third key takeaway point I'd say is get your hands on feet. It's Lucy, tell me, how much do you, as far as diagnostic equipment goes, is your clinic a high-tech based clinic, or is there a lot of equipment, machinery, or stuff that is utilised in the clinic?
We are a very high-tech clinic. We don't have as much diagnostically. We do have an ultrasound machine in one of our clinics, but
Yes.
diagnostically, not so much machinery, but more treatment. We have quite a few machines.
Okay. What do you think is your most important diagnostic tool?
It's my hands.
and,
Being
how,
able to feel things.
and how much did they cost? Like, where did you get yours? Is there a good supplier that you can recommend?
Well, on the black market, they're quite expensive, but mine were free.
They came with the whole package, is that what you're telling me?
They came with the whole package.
Nice, and a great package it is too. All right, now, Lucy, when you began mobilising clients, did anyone say no?
No, nobody said no to it.
Okay, so what did those clients, those patients say when you first started working on them?
Well, some of them I did without them knowing what I was doing. I was just like, I'm just going to feel through your joints and see how they're feeling right now. And I'd go through the protocol of just mobilising joints. And they thought I was just assessing their feet.
Yeah, okay, and I guess you literally were, weren't you? If you're going through each individual joint and checking the quality and movement in the joints. Yeah, excellent. And so what did your patients report about you doing this to them?
Well, the ones that I was doing just the mobilisation through general care, a lot of them, like after treatment, they're like, oh, my feet feel like I'm walking on clouds.
Nice.
Just after mobilising, no manipulation or anything like that.
Yes. Did you have any adverse reactions? Was there something that happened that surprised you or concerned you?
I had one patient report back after I did a mobilisation that their right foot was burning,
Okay.
which went away after a day, and it was a very odd thing.
All right.
We weren't really sure what caused it.
Okay. And could you guesstimate how many patients you have seen or mobilised as a total number compared to that one that had that type of reaction?
Well, my statistics for the year are 1,235 patients. So that's 1 out of 1,235 patients.
Okay. I was just hoping you could be a little more specific than that, but no, that'll do. Oh, well done. That is fantastic. Over what period of time is that, Lucy?
That's from January till May.
So you've seen 1,235 patients since January up until the end of the month of May. Is that right?
Yes.
Man, so you don't believe in sleep?
I don't sleep all that much now that I have a puppy, but
Great, nice work. Oh, that is spectacular. Lucy, is there anything that you would like to share with your colleagues or members of the FMT family who would be listening to this interview?
think outside the box. Podiatry isn't just what you've learned at university. There's so much more in this world you can do as a podiatrist, and we should be doing as a podiatrist.
Now that is very wise, sage-like recommendations. Lucy, I want to say thank you very much for giving us of your time and your experience, and also please send our best to Bruce, and hopefully he's not missing you too much, but he looked like he was pretty happy puppy from what I could see. No, wonderful. Lucy, this is fantastic. Really appreciate what you've been able to contribute to your professional colleagues. Thank you to the FMT family for listening to this interview and for being part of this FMT family. Until next time, serve with spirit, consult with care, and fix more feet today.